Well, with all of us being out in the summer sun these days, we brought oncologist Dr. David Mooney here to talk about protecting ourselves from skin cancer. Welcome in, Dr. Mooney. Well, I always, back in the day, when I was growing up, we basically laid out with baby oil.
Yeah.
I mean, it might as well have been Crisco.
Yeah.
And we didn't know anything about it. And these days, I've had a few pre-cancers taken off, and finally, they found a little cancer there.
Yeah.
So I'm all about it. So tell us what to do to keep from getting this.
Sure. Well, like what you said, skin cancer is one of the most, or is the most common skin cancer in the U.S., or skin cancer is the most common cancer. About 3 million Americans diagnosed each year with skin cancer. So. And
if you get checked periodically, it's something that hopefully they can catch in time, right?
Yeah, the goal with getting periodic prevention checks or screening checks is to catch those cancers at a small stage before they've had a chance to grow into something that may have spread somewhere else. Because if you catch it early, it's pretty easy to just resect it and take it out.
Now, do you bump into a bunch of people that are about my age, or in their 20s? But I'm just saying that from my generation that maybe didn't protect themselves early on, and we just didn't know.
Yeah, no,
that run into more cancers.
Right, yeah. Skin damage builds up over time as the ultraviolet radiation, each time you're hit with it, can penetrate in and damage the DNA that then over time, those damages build up, can cause a skin cancer. And so now we're trying to push, especially at the young ages, for everybody to protect against skin.
And wear a hat or the skin block stuff.
Yeah, sun protective clothing.
And you don't have to have a history of skin cancer to develop it, do you?
No, most of them aren't. Most of them don't have any prior history. But if you do, or especially people with fair complexion, light hair, blue eyes, those type of things, your skin's much more susceptible to the ultraviolet radiation. And so if you do have those risk factors, you definitely should talk to your doctor about both self-screening as well as having a doctor, either your primary care or a dermatologist, sort of review your skin.
Yeah, just examine it. And, and if you've never been to one of those doctors, they just they can freeze it with a spray. It doesn't even hurt. I mean, it stings a little bit. Yeah. But it's a relatively minor, very minor procedure.
Yeah.
Could save your life.
Yeah.
Okay. Well, doctor, thank you very much.
Okay.
I'm gonna keep